Welcome. I'm Jenny Chumbley-Hogue, the Medicare Hat Lady. KG Health Insurance brings you our weekly update on all fun things with Medicare. This week in the news, number one, there's a huge rumor out there that everyone is getting a $600 increase from Social Security. I know that's not Medicare, but a lot of you take both. That is absolutely false. There is no $600 increase in Social Security, which brings up our second point. Just like your Social Security number, never share your Medicare number. The only people who should have your Medicare number are your doctor's offices and your insurance agent. If anybody else wants it, especially over the phone, do not give it to them. Just hang up the phone. This week, we're going to talk about people who are still working at age 65. Lots of times people want to know, I'm turning 65, do I have to take Medicare? Well, once again, it's the government and health insurance, so there's not really a cut and dried answer. The first step to determine if you have to take Medicare at age 65 is if your employer coverage has more than 20 employees. If your employer has more than 20 employees, the employer coverage is primary and Medicare would be secondary. So if you're turning 65 and want to know if you have to take Medicare and you have employer coverage with an employer that has more than 20 employees, the answer is no. You do not have to take Medicare Part A or Part B, and you will not be charged a late enrollment penalty at a later date. If your employer has less than 20 employees, Medicare is primary, and you will need to enroll in both Part A and Part B to not have a late enrollment penalty. And if you have marketplace coverage, you are no longer subsidy eligible or marketplace eligible once you are eligible for Medicare, whether you're turning 65 or perhaps you got Medicare early due to disability. If you have marketplace coverage, you have to enroll in Medicare. If you currently have employer coverage and your employer has more than 20 employees, a few things to consider. Number one, the cost of Part B as in boy premiums. If you're single and your income is under $103,000 or married and your income is under $206,000, you will pay the standard Part B as in boy premium, which is right around $175 this year. If you make more than those numbers, you are subject to IRMA. IRMA stands for Income Related Monthly Adjustment Amount. I'm going to direct you to our website for more information, but click on IRMA at kghealthinsurance.com for those specific numbers. And if you're turning 65, but your spouse is younger than you, don't forget that going on to Medicare gives your spouse 36 months of COBRA coverage, not the standard 18. So trying to decide if you should take Medicare or not take Medicare when you have employer coverage available is complicated. We recommend talking to your local agent or feel free to schedule a call with us to discuss at kghealthinsurance.com. Other things to remember, especially if you're deciding to stay on your employer coverage. If you enroll in Part A only, which is free, so a lot of people want to do that. However, once you're enrolled in Medicare, you are not eligible to contribute to health savings accounts. So if you are contributing to a health savings account, keep that in mind. For enrolling in Part A or Part B, if you're doing it when you turn 65 during your initial election period and you're not taking Social Security retirement benefits, you can do that online. We have step-by-step instructions at our website. If you are over 65 and needing to enroll in Part B after your initial election period, and remember, the initial election period is 3 months before you turn 65, the month you turn 65, and 3 months after. If you are enrolling in Part B after that 7-month window, you will need a special enrollment form, which is attainable again on our website. You will complete Section 1, your employer completes Section 2. I recommend dropping those off at your local Social Security office. And if you're dropping it off for 2 people, KG's tips and tricks. Use 2 envelopes. I promise you it's a way better solution because you never know when they think there's only 1 person in 1 envelope. This week, our frequently asked question will be about drugs. What happens if a drug you want is not covered by your Part D drug plan? Drugs not covered can typically fall into 2 main categories. 1, they are not covered by Medicare, so it has nothing to do with your plan, but the law that governs the Part D coverage does not include your prescription. 2 easy examples for this are both Armour Thyroid and Nature-Throid. Because those are not approved drugs by the FDA, they are not covered under any Medicare plan. Another example is when the doctor puts you on a new drug that is not on your plan's formulary. Number 1, the legislation also requires that your plan cover the drug for your first 30-day prescription. After that, they do not have to cover the drug. But because the Part D legislation requires all drugs and all drug classes, excuse me for that little bump, all drug classes to be covered, you've got 2 options. Option 1, you can contact your doctor and ask them to switch you to a drug that is covered under your Part D plan. A good example for this is Eliquis and Xarelto. All of the Part D plans cover one of those drugs. However, most of them do not cover both Eliquis and Xarelto. So what you do is you ask your doctor to switch you to the covered drug. Option 2, you can ask for a formulary exception. You can accomplish this by contacting your Part D insurance company and letting them know this is the only drug that you can take, and can they please make an exception. Sometimes it works and sometimes it doesn't, but what I do recommend is that you try. It's a 30-minute phone call for a lot of money. So if for some reason your drug's not covered and your doctor does not want to switch it to a drug that is covered, I highly recommend contacting your Part D insurance company and asking for a formulary exception. Thanks for tuning in with us this week. Hope you like my new hat. This Texas girl wore a drill team hat this week. And if you're not from Texas, you may not know what that is. But it's really hot down here and it just seemed appropriate to have a drill team hat this week. Hope you have a great week. Please visit our website and schedule a call with me if you have any questions. We're here to help.